So I'm now joined by New Orleans local and one of the moderators for the Crossfire debate, Christian Winters. Christian, welcome.
Thank you for having me. I appreciate it. Thanks a lot.
So you were moderating one of the Crossfire debates at this year's conference. Tell us a little bit about it.
Yeah, so it was an interesting format. I think this is the second year, but it's more of picking an issue that may have some controversy surrounding it, or basically exchanging ideas about a particular topic that's relevant to urology. And it was certainly a nice foray of ideas and topics discussed. We focused on vaginal prolapse surgery, prolapse of the apex of the vagina, and looking at an abdominal sacrocolpopexy procedure. And the question was whether that is the gold standard and what we should be considering in everyone. And it was a very nice exchange. I think many of the ideas supportive of that concept were brought out, certainly highlighting the benefits of the procedure. But then also I think the balance was that there are other procedures that are available that might be better for other patients. So I think at the end, I think the take-home message was it's about finding the right procedure for the right patient and individual patient selection.
I mean, it was standing room only from what I hear. It's obviously a very popular idea.
That's what I could tell standing there. Yeah, I think everybody seemed to like the format, and I got a lot of good positive feedback after. And based on what I saw, I think it's going to be probably even better attended next year.
It's interesting though, isn't it? Because big conference, a lot of people, a lot to discuss, a lot of guidelines, a lot of information to get through. But it seems to be a very popular way of getting people to focus on something.
Well, I think the nice thing about it for the practicing urologist, I can't imagine how great of a session it would be to go to hear about vaginal prolapse surgery, then to hear about focal therapy for prostate cancer, ESWL for the management of stones, and just have such a balance there where things that are walking into your office every day, you just in 3 hours you got a really contemporary overview of a lot of that. So I think it's a great balance, and also for those that are specialized in a certain area, coming in for that particular topic, and you get a little bit more discussion. So I think it's a great balance, and I think there's some neat things that they've been doing the last couple of years to look at issues in various ways that are a lot more interactive for the audience.
Well, thanks ever so much indeed for talking to us. Really appreciate it.
No problem. Thanks for having me. Appreciate it. Thank you.